Very good afternoon to everyone on this call. Sorry, you have to bear with me. Currently, I had to get a place. I'm waiting to enter another meeting. It has been a very busy week for us, commemorating the World Cancer Day 2024. Now, I bring to you glad tidings, warm greetings from the Nigerian Cancer Society, the umbrella organization for all cancer NGOs in Nigeria. Now, this particular ongoing workshop is very fundamental because what all we are talking about, the presentation by Dr. Bingham has been very insightful because everything we are talking about is centered around how the news is delivered. And therefore, the importance of language can never be overemphasized. And this is the reason why this particular workshop is very critical. So I want to commend the organizers for putting this together in order to make efforts towards addressing the cancer care gaps. Now, in countries like Nigeria, basically in almost every low and middle income country, you have variety of issues, associated with human resource for health. And that is the major problem why patients or clients don't get the adequate attention they deserve. Let's take a case of Nigeria, for example, with a population of close to 215 million. And we are boasting of less than 100 clinical and radiation oncologists. How many cancer therapists do we have? How many oncology nurses do we have? So sometimes you ask the question, how did these health workers cope, with the amount of work in their hands? Now, as a medical personnel, whether you have 100 patients to see or you have only 5 patients to see, it is important that any patient that comes to you gets the best of care. So we just have to try as much as we can to create the time, despite the fact that we don't have the time. So I think there is a consortium to which the Nigerian Cancer Society belongs to that has been working around this area of breaking bad news. There are organizations, particularly those ones that are working on palliative care, that are talking about this matter of language, of breaking bad news. This is very important if we truly want to change the narrative of cancer care on the African continent, if we truly want to address the cancer care gaps that exist. Anytime a patient gets across to me, maybe upon a referral by somebody, as the president of the Nigerian Cancer Society, thinking that he or she will have a one-stop approval or a one-stop solution to his or her problem in terms of finance, I always take my time to listen and to say good words, to take my time to explain why we don't have funds at our disposal. Because it's very important so that that patient cannot lose hope, that patient can be positive and know that the system may not be ready to help at this time, but there are plans on the way to improve policy, to improve funding. So I want to once again congratulate organizers of this event and appreciate the presenters that will surely do justice to the topic. And I want us to take it very seriously because communication, effective communication is very important towards addressing the health inequities, towards addressing the cancer care gaps that we have. Thank you very much, and may God bless you.
Thank you, thank you, thank you. We do appreciate you, and we have seen your sacrifice, that you are in between meetings and you have spared your time off your busy schedule to join us for our cancer training for Africa. Thank you very much. In the house, we are joined by people from all over the world, all over the African continent, and we are sending love and greetings to people joining from Benin, Ethiopia, Nigeria, Uganda. We know Kenya is in the house, Zimbabwe, Botswana. We have South Africa, Lesotho, and also Ghana. Let us know where you are joining us from. So tell us your name, the institution that you represent, and the country that you are coming from. We'll be very glad to hear from you.